بسم الله الرحمن الرحيم. الأذر سيستم احنا عارفين ان هو من الحاجات اللي هو يعني إعجاز الخالق سبحانه وتعالى. نتكلم على الأول على الهايبر كالسيميا sign and symptoms. excessive thirst يعني excessive thirst and frequent urination, nausea, vomiting, constipation, bone pain, muscle weakness, depression, confusion, lethargy, fatigue, palpitation and cardiac arrhythmia, decreased reflex, hyperparathyroidism, ECG, hypercalcemia برضو, widen QRS, shorten QT interval, widen QRS complex, indication of patient developing congestive heart failure. widen QRS معناها ان هو بدأ العيان في الهارت فيلير. hypocalcemia, prolonged QT interval, lung cancer or breast cancer, tuberculosis, stimulated digestive tract to absorb calcium, saccharosis, stimulated digestive tract to absorb more calcium, dehydration, hypernatremia, hypercalcemia, hyperkalemia, ECG, widen QRS, flatten V wave, big DT wave, increase the hematocrit, increase the red blood cells, sunken eyes, fontanella, orthostatic hypotension, cardiac arrhythmia, dizziness upon standing, increase the heart rate. بعد كده decrease the systolic and diastolic blood pressure. Lithium drugs used to treat bipolar disorder increase the release of parathyroid hormone. Woman over 50 years old, complication, osteoporosis. Treatment activity, focus on weight bearing activity and extension exercise, limit inflection and rotational activity. Kidney stone, kidney failure, confusion, dementia, arrhythmia, muscle weakness and diminished deep tendon reflexes, decreased deep tendon reflexes, hypocalcemia, increased deep tendon reflex, increased muscle cramps, increased muscle fasciculation, long QT interval, chauvinistic sign, tapping the air and see the patient reflex response on the face. تلاقي بيرعش عضلات وشه بترعش. trouser sign اللي هو breathing blood pressure cuff on the patient upper arm and increase pressure. بعد كده الهايبوثايروديزم، هيميوستيزيس، الحشموتو ديزيز اللي هو بتاع الثيرويد جلاند، overdosage with anti-thyroid medication, chronic autoimmune thyroiditis, atrophy of thyroid gland, decreases thyroid releasing hormones secreted by hypothalamus, weight gain, mental and physical lethargy, dry skin, decreased blood pressure, constipation, intolerance to cold. طبعا بدل في hypothyroidism يبقى intolerance to cold. If untreated could potentially lead to myxedema, severe hypothyroidism, swelling of the hand or feet or face, coma and death, proximal weakness, deep tendon reflexes, prolonged treatment, lifelong thyroid replacement therapy. Red flag طبعا poor exercise tolerance, weakness, apathy, exercise induced myalgia, decreased cardiac output, sign and symptoms of hypothyroidism. Thyroidism ده دايما psychological, poor memory and concentration, poor hearing, pharynx hoarseness, دبحة في الصوت, heart slow pulse rate, pericardial effusion, muscular dilated reflex relaxation, extremities بيبقى فيها coldness وcarpal tunnel syndrome, bilateral مش في ناحية واحدة, reproductive system, menorrhagia, intestine constipation, ascites, البرستريزس تبدأ تقل لأن طبعا الكالسيوم مهم جدا في حركة العضلات. باراسيزيا، ميكسيديما، shortness of breath, pleural effusion, hair loss, poor appetite, weight gain with poor appetite, feeling cold, فتيج. ادي الهايبوثايروديزم وادي الهايبوثايروديزم. بعد كده هنتكلم على السيمتومز اوف هايبرباراثايروديزم اللي هي فاين بريكر هير، كريتال بريسبيريشن، عرق كتير، enlarged liver, nausea and vomiting, hand tremors, excessive production of thyroid hormone, irritability, hyperactivity, high blood sugar, intolerance to heat, low serum cholesterol, bulging eye, enlarged thyroid, abnormal heart rhythm, increased appetite, loss of libido, amenorrhea. بعد كده deep tender reflexes, increase الهايبرباراثايروديزم، exercise intolerance, proximal weakness. دايما دي الحتة بتاع proximal weakness، joint stiffness. بعد كده Addison disease bronze pigmentation of the skin، يعني لازم اللون البرونزي، هايبوغلايسيميا، بشرة هايبوتنشن، weight loss، gastrointestinal disturbance، weakness، adrenal crisis، profound fatigue, dehydration, vascular collapse, decrease blood pressure، renal shutdown، decrease serum Na, gastrointestinal disturbance, ulcer, diarrhea, loss of appetite, stomach cramps, weakness, decrease endurance, intolerance to cold and stress, lack of glucocorticoid، hypoglycemia، hyperkalemia. دايما الاتنين عكس بعض. dehydration، monitor exercise tolerance، monitor vitals، provide carbohydrate and protein diet. hyperkalemia، widen QRS، flatten V wave، big D T wave. hypokalemia، flatten T wave. inverted producing U wave. hypercalcemia، widen QRS, shorten QT interval. hypocalcemia، prolonged QT interval. hypothermia، elevated ST segment, decrease heart rate. بعد كده ST segment elevation أكثر من 2 مليمتر. stop exercise لازما على طول. myocardial ischemia، ST segment depressed can be up sloping, horizontal or down sloping. myocardial infarction، ST segment elevate أكثر من 2 مليمتر. need to confirm. digitalis depressed ST segment, flatten T wave, الQT shortness. over dosing sign، ST segment is presented downward cupped shape. Coandine used to control cardiac arrhythmia. QT lengthen, T wave flatten, QRS lengthening. Beta blocker decrease heart rate, blunt heart rate response. Monitoring RBE scale, rate perceived exertion. Nitrate increase heart rate. Used for stable angina. Stable angina patient has pain during activity, subside at rest. Unstable angina patient has pain during activity, pain continuous during rest. stop BT treatment، كل 911. anti arrhythmia agents، coandine، prolonged QRS and QT interval. يبقى النيتريت اللي هو نيتروجليسرين اللي هي سبلينجوال دول في ستيبل انجينا ونستيبل انجينا. بعد كده الديفرنس between type 1 and type 2 diabetes mellitus. type 1 young age, normal body mass index, not obese, no immediately family history, short duration of symptoms, weeks, can present with diabetes, coma, diabetic ketoacidosis, insulin required. type 2 mildly aged, elderly, usually overweight, obese, family history usual, symptoms may be present for months and years, don't present with diabetic coma, insulin not necessarily required, previous diabetes in pregnancy. The main symptoms of diabetes: central polydyspepsia, polyphagia, lethargy, stupor, systemic weight loss, respiratory cosmal breathing, hyperventilation, eyes blurred vision, breath, smell of acetone, gastric nausea, vomiting, abdominal pain, polyuria, glucosuria. شكرا لاستماعكم، وكده احنا خلصنا الجزء اللي هو بتاع الأذر سيستم.